Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Kami ucapkan selamat datang untuk Bapak Ibu yang kini telah hadir di antara kami untuk mengikuti acara guest lecture dengan tema Challenge and Solution for Managing Health Insurance Process yang diselenggarakan oleh Departemen Kebijakan dan Manajemen Kesehatan bekerja sama dengan Pusat Kebijakan, Pembiayaan dan Manajemen Asuransi Kesehatan beserta kanal pengaturan FK-KMK UGM. Saya selaku Gitka Nabila yang menjadi MC pada hari ini memohon izin untuk membacakan susunan acara. Acara pertama yaitu pembukaan dari Bapak Dr. Lutfan Lazuardi, MKes PhD, yang merupakan Ketua Departemen HPM. Dan acara kedua yaitu penyampaian materi oleh Bapak Yusran Mawardi, selaku Asisten Deputi Analisa Data dan Manajemen Informasi BPJS Kesehatan, dan dilanjutkan oleh Profesor Dr. Jens Geisler dari POM University Hamburg, Germany. Acara pada hari ini akan dimoderatori oleh Ibu Dr. Dia Ayu Puspandari, MKes MBA APT. Acara pertama yaitu pembukaan dari Bapak Dr. Lutfan Lazuardi, MKes PhD. Kepada Bapak Dr. Lutfan, waktu dan tempat kami persilahkan.
Ya, terima kasih Mbak Gitka. Suaranya bisa kedengaran ya?
Baik, bisa terdengar dengan...
Very good afternoon, ladies and gentlemen. It's really a great pleasure to meet you again. And today I think we have a very important issue to be discussed. As probably you all know that since 2004 we have regulations related to the social security or social security system, which is later in 2014, 10 years later, then we have what's called BPJS Kesehatan, and we aim to have to reach the universal health coverage in 2019. Although probably not yet not yet achieve the target, but I think we learn many things, and today we'll actually have two presentations from Professor Jan Geisler and also Pak Jusran Mawardi, which is, I think, will be very good things to learn how our national health insurance progressing, as well as what are the challenges, and also how to deal with the issue that we have to face. And I think we'll learn a lot from the presentations. And I would like to say thank you very much, Professor Jan Geisler from the FOM University of Applied Science in Germany, as well as Pak Jusran Mawardi, the Assistant Deputy for Data Analytics and also the Information System at BPJS Kesehatan. And not to make further delay, I think we'll looking forward for your presentations, and for these sessions, Ibu Dia will moderate the session. So we'll just give the sessions to Bu Dia. Please, Bu Dia. Thank you.
Terima kasih kepada Bapak Dr. Lutfan atas sambutannya. Selanjutnya, Bapak Ibu, mohon izinkan saya untuk membacakan CV dari moderator kita pada hari ini, yaitu Ibu Dr. Diah Ayu Puspandari, MKes MBA APT, dan saat ini menjabat sebagai dosen di KPMAK Magister IKM FK-KMK UGM. Beliau merupakan lulusan dari Universitas Indonesia dengan jurusan Farmasi, Indonesia Institute of Management, Master of Business Administration, dan juga lulusan dari Universitas Gadjah Mada, Magister Kesehatan Masyarakat, dan mengambil gelar doktor di Universitas Gadjah Mada. Baik, kepada Ibu Dr. Dia Ayu Puspandari, MKes MBA APT, waktu dan tempat kami persilahkan.
Terima kasih Mbak Gitka. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang dan salam sejahtera. Saya Dia Ayu Puspandari dari Departemen Kebijakan dan Manajemen Kesehatan FK-KMK UGM akan memandu kuliah tamu siang ini yang terselenggara tadi sudah disebutkan bersama dengan Pusat KPMAK dan Prof. Jens Geisler dari FOM University Hamburg, Jerman, serta dari BPJS Kesehatan. Topik kali ini yang akan kita angkat adalah challenges and solution for managing health insurance processes. Izinkan saya menggunakan dua bahasa Indonesia dan Inggris. Semoga bisa membuat paparan dan diskusi yang lebih hangat dengan narasumber tamu kita. So allow me to speak in two languages, which is I hope that it could stimulate a lively presentation and discussion during the lectures. So we have two speakers. The first is Pak Yusran Mawardi. Beliau adalah Asisten Deputi Analisa Data dan Manajemen Informasi BPJS Kesehatan, and Prof. Jens Geisler from FOM University Hamburg, Germany. Good morning, Prof. Jens. It should be still around 8 AM Hamburg time?
It's actually 9 o'clock now because
okay.
We had the change to summertime. And so I actually had 1 hour more of sleep.
Okay.
But still early morning.
Thank you, Prof. Jens. Jadi sebuah organisasi besar seperti BPJS Kesehatan tentunya memiliki aktivitas yang begitu banyaknya dalam menjalankan berbagai fungsinya. Tuntutan mulai dari mutu layanan, besarnya peserta yang harus di-cover, tentu ini menjadi perhatian bagi BPJS bagaimana organisasi ini menjalankan bisnisnya secara optimal. Nah, bagaimana pengelolaannya? Kita akan mendengarkan paparan dari Bapak Yusran. So, as we know that BPJS Health has a huge activities, especially to maintain their optimal functions to serve more than, let's say, 222 million up until now. So, how they articulate this in their business process? So, I would like to invite Pak Yusran Mawardi to present. So, the time is yours, Pak Yusran.
Baik, terima kasih Bu Dia. Saya izin share screen ya Bu ya.
Silakan Pak.
Apakah layarnya tampil tuh?
Sudah terlihat Pak tadi?
Terlihat ya. Oke. Assalamualaikum warahmatullahi wabarakatuh. First of all, thanks Bu Dia, thanks Prof. Jens. Also thanks to this precious time. I also apologize because at first it was the President Director that has not been able to attend this event because there is also another agenda in BPJS Kesehatan, some kind like an annual leaders meeting to align the strategy for all leaders in BPJS. This activity should be done earlier in the year, but since the turn of the new board of directors, so this activity was finally set at this time. Please allow me to share some things about the GKN, and hopefully I won't go too deep into GKN because I believe you guys already know as well. And I also like to learn a lot from Mr. Jens. Okay, so my outline here about I will share about Social Security Health Program in GKN in numbers, and also about the transforming into digitalization and lesson learned from the digitalization into the ecosystems. According to the ISA in 2019, there are 10 global challenges in implementing social security programs, such as health and long-term care, closing the coverage gap, population aging, technological transition, high public expectation. If we see at the, let's say on the first global challenges such as long-term care, there are also let's say, non-communicable disease such as heart disease, cancer, and diabetes also has a burden of the health program in JKN, maybe around 17% in total of cost of the JKN. And in terms of technological transition, as a wide social economy, I have discussed with Budia who is the initiative to the digital transformation. Is there a CEO or CIO? But unfortunately, COVID is force everyone to do the digital transformations. And in terms of digital transformation, and if we look to the Asia Pacific challenges, I think the number 4 and number 5 is still same, and it's also the challenge in the Asia Pacific as well. Because in the technological transition will be demand for the public services, because increase the expectation of the public. The expectation of the e-government should make easier to deal with the government department or agency, since everyone know about the mobile apps, transition of the portal web, anytime, anywhere. So I think 24/7 access, this will increase the higher public expectations. Okay, I think this one is just a very very fast for me, because Indonesia, as you know, this and the horizontally we have around 5,000 kilometers, just like sorry, Prof, just like from the New York to the London, and also the population itself on the country profile, we have around 270 population based on our last census. That means we are the 4th highest population country in the world. And also, based from the World Economic Forums, we have 60% digital native. And that means around 153 working age population. It's also the another challenge, right? Because the population is keep increasing. And we have very the largest archipelagic country in the world, of James, around 17,000 islands, and also the local government and all of that. And in terms of social security, we have covered around, JKN program have covered around 222 members or participants, all of the citizens, around 82%. We also work together with around 20,000 healthcare providers to serve the healthcare providers. And also we have worked together with the banking solution, around 650,000 for accessibility, to provide the accessibility for the JKN members to pay the contribution. And there are around 322,000 formal sector entities that join the JKN program. They are with maybe around 37 million employees from formal sectors. And around that, in BPJS side, we have 128 branch offices all over Indonesia, and around 300 district officers. It's a small office that to reach the distant in territory. I think that's how we reach the entire company or public. The question is how many employees BPJS Kesehatan has to running and to govern this kind of program. There are around actually we are around 7,000 employees in BPJS Kesehatan. I think that's mean we have really depend on ICT to help our internal organization to be more effective in managing this JKN program. I think this one is an ecosystem of the JKNs. We start with the yellow, start from our members. We separated from the government funded and also the self-funded. But in total, there are around government funded around 130 million members, maybe around 59%. from the total populations. And the blue one is the banking institution to serve the payment systems. Also, we also work with the non-banks such as fintech startup to deliver easiness and comfortable for our members to pay the contribution as well. And also the upper right, healthcare providers. We work together with the health facilities, maybe around 26,000, and also health organization as well to develop something like a guideline, maybe something like that. The last one is the stakeholders. That means we work closely together with the Ministry of Health, of course, Ministry of Finance, and Ministry of Home Affairs, Internal Affairs to develop the national identity numbers. If we go deep to this ecosystem and the services, I think this one is too technical, sir. I'm sorry, because in membership we deliver some portals, some kind of portal for the HRD to register their employees, and also we develop something like fast track in the branch office and mobile platform. I will go deep the next slide about the mobile platform, and also we develop something like chat services, chatbot or something like that. And on the finance system, we develop integration system with the banking, so the member could check their contribution amount of the banking system from the ATM for the mobile banking and all that. And on the JKN agent is the something like community based in every area to collect an unpaid premium. And also we have to, in terms of the burden of the payment debt of the members, we also conduct the pay letter contribution, maybe something like nyicil mungkin in Indonesian, pay a minimum premium but in the long terms. And in terms of healthcare system, we develop something like credential system so every health facilities that want to join to become the JKN member, they can register through the portals. That's transparency. And also we develop integration with the queue system, because the queue system is already based in the hospital or in the primary care. I think we have to talk together to integrate our system with the healthcare providers. And in terms of reducing the waiting time for our members to go to the hospital, because they can also order the numbers from the mobile platform, so they're registered what time they can come to the hospital health facilities. And also with the Ministry of Health, we work together about the integration of the system in the INA-CBGs, and maybe you have heard before, Indonesian case-based groups. It's like something like DRG systems. And also we develop something like rules detection and alert to help our verification system, because every day there will be 100,000 claim. I think we have to help our internal employee to more digital and help the analytics to filter where is the claim that outlier or something like that. And with the Ministry of Health, we work closely together, and also with the Ministry of Finance, Ministry of Internal Affairs about the national identity data, and also we have the data matching with the Ministry of Social Affairs. I think that's all the ecosystem of the JKN, and then some product that we have delivered to our systems. And I think all of the product will generate the data, of course, right? And also, what about the data? I think we collect the data from the members. The members can also change their benefit of class. They can change their health provider services, and also they can also pay the premium in terms of payment behavior. We can also get the behavior, and also with the healthcare providers, we also learn about the behavior of their medical record. And I think at the end we provide the customer-centric solution to our members based on the data itself. And in terms of the working together closely with the governments, we also share about the data or information with the governments and also with the academia in here. We release something like data sample, maybe around 13 million kind of records. So I hope the researcher and academia can develop increase or benefit for us to develop the strategy, how to run the better policy for the JKN itself. I think this ecosystem will go to the improve itself. This one is the sample of our mobile app solutions. We have around 12 million users, and the solution is really help us during the COVID pandemic. And we see at the March, they are really decreased in the people coming to the branch office, the blue lines, but somehow in the mobile ecosystem, mobile solution is still go increase because we change off the system from the branch office and we deliver to our mobile platform. Maybe around 20 new features. They can also change anything from the mobile app, so they don't have to come to the office as well. And in terms of mobile office, mobile apps, we also developed something like mobile apps, but for the health facilities. So the patient and the facilities can talk each other. They can chat about something like teleconsultation. They can discuss about their health, and also in case they want to go to the hospital, they can also order the register number in the hospitals. And all of that, we also provide something like WhatsApp solution, because people love chat WhatsApp. Some people don't want to install another apps on their phone, right? It's okay, but that's push us to deliver some kind of service through the WhatsApp solutions. And this one, we also have the 24 solution call centers. And growing practical about AI consists of intelligent chatbots. We also developed an AI-based service for first layer in order to respond to generic questions for the members through the chatbots. So I guess so let's embrace the digital transformation because it will lead in case of growing participant. We must make a saving in various business process through the technology. Besides that, it will minimize the process time and eliminate the constraint, and also will increase the productivity. The world is changing very fast, that with the digital era, as well as the customer need is also increased. The speed of change impact the level of customer satisfaction. That must be met through the use of technology to increase the convenience of our participant to use the services. And digital skill. Actually, Gen Y and Gen Z is everywhere. The population, they are digital native. Is very fast for us to implement the new technology for them because the learning curve is very fast for them. And also about the evolution of technology, some kind like mobile apps, big data and AI, and also the COVID pandemic situation that forced almost all of us activities to be implemented remotely, such as right now we have doing some work from home or telehealth or virtual events right now. And the last thing is also the good governance, because the transparency of the process, it will deliver the accountability and easy to understand the process through the digital of the technology. And of course, there are also a lesson learned and also the challenge for us to implement. Digital transformation provide the significant benefit that meet for administrative and public service, but somehow we also need support and initiative from the governments, from the ecosystem, maybe from the global situation, just like pandemic situation, and force us to do the digital transformation. And the second is the integration of several business process between system or between stakeholders to automation the system that will facilitate the service faster and easier. But somehow the our challenge is how to standardize the exchange of the data itself, because some government has another format of the data, and some hospital, there are 1,000 hospitals that have another format of the data. I think that is a challenge for us to implement integration of the system with another disparate hospitals and also the another primary care healthcare. And the last is the data-driven innovation or mobile technology. And internet is enabling people to access any service by themselves, self-service. But let's concern about the data security, right? I think this shifting is too fast, and I think I would like to share from you, Prof. Jans, about maybe something like data protection, GDPR, or something like that. I think Indonesia has still developed something like Undang-Undang PDP, data pribadi. I think this is concerned about the cyber attack or something like that. I think that's all from me right now. I hope you guys have some insight from me, and I would like to share from you and also learn from the Prof. Jans. Thank you very much.
Thank you very much, Pak Yusran. So, dari paparan Pak Yusran kita lihat bahwa sangat kompleksnya ya kegiatan yang dilakukan sesuai dengan fungsi dari BPJS Kesehatan sebagai sebuah organisasi yang menyelenggarakan Jaminan Kesehatan Nasional. Tadi disebutkan juga Indonesia itu sangat luas, jadi kalau naik pesawat itu seperti dari New York ke London ya. Waduh, ini panjang dan jauh sekali sebetulnya ya. Dan kalau kita lihat juga kita punya 3 zona waktu ya. Jadi memang ini menunjukkan bahwa kompleksitas Indonesia itu selain dari geografisnya juga tadi disebutkan stakeholder yang bersinggungan atau bekerja bersama dengan BPJS ini bisa kita lihat mulai dari health provider, kemudian sistem banking ya, bagaimana finance system, kemudian member sebagai peserta yang diharapkan karena ini sifatnya wajib, berarti seluruh masyarakat Indonesia terlindungi, kemudian berbagai stakeholder termasuk regulator. Artinya kompleksitas ini tentunya juga membutuhkan analisis juga ya. Di bisnis proses ini kalau mau dilakukan perbaikan itu di sisi mana dan cara apa? Nah tentu ini nanti yang akan coba kita lihat dari sisi Prof. Jens Geisler. So Prof. Jens, so we already have insight that Indonesia is so wide. So we have 3 time zones. So BPJS has to spread their wings, so to cover all Indonesian citizens everywhere, every time. So I think business process management as a discipline which is all the complexity and to know how to allocate or to modeling a strategy to ease all these difficulties. So let us hear from you, Prof. Jens Geisler, about this business process management. So the time is yours, Prof.
Thank you. May I start by asking 2 questions to Pak Yusran?
Okay, so,
because something I want to do is, shall we say, reality check. You mentioned in your presentation 128 branch offices, 388 offices, about 7,000 employees. How many of these employees have a computer on their desk and work with it every time? That is the first part of the question. And the second part of the question, how much paper would I see in those offices?
Ya, silakan Pak Yusran.
Okay, thank you, Prof. Actually, I don't know how many laptop. I think we have changed the PC to the laptop at this year. Actually, we rent. I think we're not only buying the we just rent the laptop to every of our employees. And I don't know how many members, how many employees that already has the PC or laptop in their on their desktop, on their desk. I don't know, maybe more than 95%, I bet.
Okay.
Yeah. Okay. And about the papers, they're still on the papers. We are not moved to the fully digital, because there are also something like an audit process that they have to sign manually. You know that. I think that we need an ecosystem to running the something like digital signature or something like that.
Mm-hmm.
So I think in terms of digital, let's say from the hospital to the BPJS, we develop system that work together, but somehow the paper is still need in terms of an audit system, because in audit, I don't know, maybe 5 years or 10 years, they can also come to check every paper they sign about from the patient and also from the hospitals. I think that's at the first that our challenge, Prof. I think we need the ecosystem to running the, let's say, digital transformation, digital signature, or something like that. That the proof that this is the really sign from the users or from the patients.
Mm-hmm.
That's all, Prof.
Thank you.
Yeah.
The reason why I ask is that your presentation was so wonderful. And I think it is sometimes good to see how much of what you showed is already taking place, or how much still needs to be done. Ibu Dia used this wonderful expression of spreading the wings. So there is a very good plan what the wings are supposed to look like. The question is, how much of the wings can we already see? Are they already spread? To what extent? And is the bird already practicing to fly? And that's why I want to go. Pak Yusran showed the picture from the very top, from a strategic level, and I will go to the very, very, very bottom, because what I like to do is to see what does the branch office look like? How are people working there? Because at the end, you said it, big country, big organization, must be very decentralized. So the huge challenge which you have, if we talk about management of BPJS, how do you actually make sure that your very thought out strategic plans from Jakarta actually make their way to Sulawesi or Borneo or wherever? So does it get lost on the way? And that will lead me to my first point, which is business process management. So let me try to share my presentation. For some reason, I cannot move my presentation.
Okay, so it's already for the first slide.
Yes, but I was not able to move it.
Okay, so do you need?
I will try once more.
You can unshare and reshare again, sir.
Oh, okay.
At first, you're running.
I will try once more, so I can move here. No, for some reason.
It's okay. It's okay. You can unshare and then reshare. Please do not close the PowerPoint. I also face the same problem.
Okay, so you have the same experiences. So if you need assistance, please let us know.
I will try once more. I will try once more.
Okay, so
if it really doesn't work, I would just use the presentation which I sent to you, Dia.
Okay.
No. Honestly, I have no idea.
Okay.
It is totally stuck.
Okay.
Ibu Dia.
Okay. So
I will try to use the PDF.
Yeah.
We try that. What's the next plan?
So I'm sharing the PDF.
You're already doing it. Okay, we do it that way. Good. So good. Yes, what I will talk about is project management and business process management. And what I will try to tell you is about their importance, why they are important. Ibu Dia, can you maybe mute your microphone?
Yeah.
I have feedback. What I cannot do is to actually tell you too much how to do it. There's one thing to understand why it's important, and the other thing is to actually know how you go about it. And that takes much more time. What I did is, you will find in the end, I put in 2 links from YouTube. There's a lot of practical material about business process management, things where you can get some more ideas about how to do it. A lot of it is learning by doing. This is not so much a scientific thing, it's more a practical management tool. And I will not talk too much about my background, but you see their project experience in digitalization, automation, business processes. I did this that was my main job for roughly 10 years as a consultant, advising health insurances, accident insurances in their business processes. Now, I'm not an IT person. My background is political science and business management. And actually, I think to do the things which I'm talking about, it's important to know you probably shouldn't be an IT person. This is not the perspective of an IT person. It's the perspective of a manager. And so that is what I will be talking about. And as I said, it's not so much a scientific issue, it's more a practical management issue. So you will not find so much scientific literature about it, but more in the practical management stuff. Okay, yes, this is the right place. Dia, go up a little bit more, because I want to, yes, that's perfect. The 2 terms, both terms, you see here, I wrote business process management in brackets and project management in brackets. So you have the term business processes and you have projects. Now, both are not specific to health insurance. You can have business processes anywhere where there is business, and you can have projects anywhere. Now, I will tell you in a minute why they are very relevant for health insurance. But here I want to spend a moment to give you an idea what business process management and project management is, by using examples outside the health insurance field. A business process is a sequence of activities with one start. It starts at one point and it can have different endings. And I will show you what I mean with these different endings. Now, where do we have sequences of activities? We have them in production. The classical example is a factory which produces anything from smartphones to furniture. So this would be a sequence of activities. But to use an example even more familiar to everybody, take a restaurant. The restaurant needs to buy its groceries. So every day somebody will go to the market. Well, that is one activity. The person will select the food, the person will pay the food and will drive back. So we have one process. And then probably another person or maybe even a group of people will start preparing different meals. And they do this always in the same sequence. They do their preparation activities, and then maybe they have their condiments and somebody takes care of the fish and whatever, but it's all sequence of activity, which then at the end produces a meal. That is the result, or a number of meals. And it produces them always at the same quality. This process is carried out by staff, by types of people. So you have the one who buys the groceries. You have the head chef, you have maybe an assistant chef, and you have somebody who chops the vegetables. So you would have 3 different roles, or you could say type of staff. And why do you do this? They perform a business process probably without thinking about it. They have always done it. And since we're in a restaurant talking about a group of maybe 3 people, it works out perfectly fine. But still they do it because they have developed a good way of doing it in a standardized way. Now just imagine that you're not running one restaurant, but you're running 200 restaurants. So you have much more people. Or now a health insurance with 128 branch offices. So roughly the same idea applies. And I will make that more explicit when I give you an example. You have sequences of activities which if they are standardized, if they are performed in the same way, they are done in the most efficient way. And Pak Yusran already talked a lot about digitalization. Nowadays, especially with the large volumes we're talking about IT. You need IT systems to do that. So I will hint a little bit about the connection between business process management and digitalization. Now, where do the projects come in? Normally, and we'll come to that in a second, business processes are not as good, as efficient as they should be. That means you have to improve them. You have to raise the efficiency. You have to change the way that digital tools are used. Now, how do you do this change? The first is analysis and documentation. That's the business process part. But now comes the part in saying, how do we actually solve our problems? We say, now in the past, we did this process on paper-based. Now we want to do it in digital form, or at least some parts of it in digital form. And that is on the bottom part, you see project management. And the first point is clear objectives. What do we want to achieve? We want to increase the efficiency of a certain business process by implementing digital tools within the next 6 months. So that would be the objective. Now, not everything you want to do is a project. It might be sometimes difficult to get up in the morning, but getting up in the morning is not a project. Because specific points for projects, they're new. You organize something in a project which you don't do every time. And because you don't do it every time, there is not so much experience. So, Pak Yusran, I assume that for the digital ecosystem you talked about, of course, you develop some experience then in adding more pieces. But generally speaking, most of this stuff you're doing, you as BPJS, you're doing for the first time. And so organizing that and thinking about what can go wrong, how do you plan that? It needs a project, it needs planning. And the second feature is what you're dealing with is risky. Risk always means it can go wrong. And can go wrong means, Pak Yusran talked about loss of data. So maybe you have a problem with your design and the data protection is not good. Or you spend money on a system, but it doesn't really do what you want it to do. Or it is there, but not really used. There are many things which can go wrong. So that defines a project. And the way to go about it is very good planning. You need a project plan, and I will talk very, very briefly about that. And you need a good team of people. I think the most essential thing really is to put together a project team, selecting the right people for a team. And it is one specific team for one specific project. So you think about what is our objective, what is the task, what is supposed to be done, and who are the best, the very, very best people in my organization which can help me in doing that. Now, this last point, project management or project methodology, there are a number of methodologies. You don't have to invent that. It sometimes helps. Large organizations sometimes say, we always use one methodology and we train people in one certain methodology so they speak the same language. And what I wrote down here, Prince 2, is a British methodology, project management methodology, which is actually my preference. That's the one which you need to adapt it a little bit because it's very generic, so you have to adapt it to your style of organization. But generally speaking, you need to have a clear plan how you manage the projects. So the task is you, but the approach to project management should be more standardized, at least to some extent. Okay. Now, the reality check. So here, typical indications that business process management needs improvement, that you need to do something. And these are, maybe go down that we can see all the bubbles. One more down, yes. No, too far, yeah. Yes, perfect. Now, these are questions which I actually always show my students. I didn't talk about my university, but when I introduced myself, many of my students actually work in health insurances. And so there are either normal staff members who want to go to reach management positions, or they have already reached, shall we say, team leader positions, like low management positions. And so they're still very much connected to the ground. They know what is going on. Sometimes they know it maybe better than the ones at the central office. And so I ask them, which of these statements, which I have heard in many of my projects, which of them apply to you, to your daily working situation? Take the one on the left top. It is difficult to take over a task from a colleague, maybe because he is sick, because there are not enough clear standards. So oftentimes you have, especially the difficult things you're working on, the difficult cases, somebody has started and then somebody else needs to take over. And then if all these things, the cases which you get are very different, you get very frustrated because you think, oh, well, my colleague should have done that. And why has this not happened? It saves a lot, it wastes a lot of time and it makes people frustrated. Top right, staff members in one team treat similar cases differently in one team. So you have maybe in one branch office, maybe you have 3-4 people doing the same kind of activities, but they don't really do them the same way. So it depends a little bit on luck as a customer, if you get the one staff member or the other. Two further down, teams in different areas, like in different regions, work differently. That is the same idea, but on a little bit more global level. That maybe you have a similar business process in one province and in another province, but they don't do it the same. Why is that the case? Isn't there one good way of doing it? We have clear standards, but we are not sure if they are always followed. Like most administrations, and health insurances are administrations, have standard operating procedures. Things are written down somewhere. But is real life always in line with these standard operating procedures? Do you know? Are you sure? So, and then going one down, the time to perform certain tasks is too long. Our customers are not happy with the service quality. So how long does it take, if you have a question, or if you have something which you expect from the organization, from the health insurance, how long does it take to get an answer? And the one at the bottom, we have to work more efficiently than in the past because our numbers of customers is increasing drastically. We simply have to do more work. And staff is either difficult to get, or there's not enough funding to pay for additional staff. So sometimes you have the situation that the number of staff does not grow in line with the number of tasks. And that again is something which would make it necessary to think about business process management. Now, when we prepared for this, I asked for Pak Yusran if any of these statements sound familiar to him relating to BPJS.
Okay. Please Pak Yusran. Jadi teman-teman, Bapak Ibu sekalian, ini barusan Pak Prof. Jens memperlihatkan kepada kita bahwa kondisi sehari-hari ini kadang realita, walaupun misalnya sudah ada SOP, kemungkinan bisa dilakukan bervariasi begitu ya. Tadi melihat bahwa begitu banyaknya misalnya kantor cabang atau hal-hal yang melibatkan banyak tim begitu. Jadi Prof. Jens menanyakan kepada Pak Yusron, kira-kira mana ya, adakah contoh-contoh kejadian sehari-hari begitu di lingkungan BPJS? Pak Yusron, silakan.
Yes, thanks, Prof. I think it's difficult over task in the upper left. We have yeah, maybe you have also mentioned about the SOP, right? And also we have implemented the SOP, especially in the highly regulated system. I think in the BPJS, we have a guideline to, let's say, to do something like a verification item of the claims. We have some guidelines that we work together with the Ministry of Health to implement this guideline rules or something like that to our system. So hopefully, I think still hopefully, every verification officer speak at the same language, so they can also rely on the systems. But I think the most interesting is level of qualification. The right one. We also have we have difficulties allocating tasks to staff with the right level of qualification. We have also something like, Jens, you know that something like self-service analytics. We have provide them with the data, and also we have provide them with the platform. So hopefully we speak in the same language. No other platform they can use anything you can ask, Power BI, Tableau, Stata, something like that. We have strict to only one problems, and also hopefully all of our team can speak the same language to learn the same language about the data analytics. But somehow, yes, that's true. The qualification is different, right? Some people learning very fast about the how to talking with the data, but some is very far about very not quite good to understand how to running something like statistics, something like that. I think that's two cloud I already share. Maybe some of us want to share with us, Prof.
Oke, baik Pak Yusron. Apakah dari teman-teman ada yang ingin sharing juga mungkin contoh-contoh kejadian sehari-hari? Tadi disebutkan bahwa kemungkinan interpretasi juga bisa dilakukan secara bervariasi begitu ya Pak Yusron, melihat dari kualifikasi dari sumber daya manusia juga yang berbeda-beda atau ada variasi juga antar daerah. Tentu ini juga membuat satu tantangan tersendiri begitu ya, karena asuransi kesehatan ini kan bidang yang sangat padat regulasi begitu kata Pak Yusron tadi ya. Mungkin adakah teman-teman yang ingin sharing? Silakan membuka mic jika ada. Apakah ada? Ya, mungkin saya bisa angkat satu permasalahan mungkin yang seperti registrasi atau kapan sih sebetulnya bayi baru lahir itu terregistrasi begitu ya Pak Yusron? Ada yang masih dalam kandungan berapa bulan, ada yang sudah ketika sudah dilahirkan dan lain sebagainya. Artinya mungkin ini jadi masukan juga ya untuk kita bersama bagaimana pemahaman gitu ya, dan bagaimana ini juga dipahami secara sama begitu dari sisi, karena tidak hanya dari BPJS, kemungkinan juga dari health providernya dan stakeholder lainnya terlibat. Apakah betul demikian ya Pak Yusran?
Ya, makasih Bu. Memang terkait isu bayi, pemahamannya ada sedikit berbeda lah terakhir ya, terkait terminologi. I think we have to really understand about in the presidential decree, because I think it's very high level, right? So we have to turn it down to the implementation level so everyone can understand about the presidential decree, but how to check the disclaim. I think the understanding about the regulation is also we have to make this similar in other area, because back on the first my slide, I think the Indonesia is very broad. And also the education level itself, you know that it's really different. Everything in Java and province and Sumatra, but what about the East Indonesia, something like that? I think that will be another challenge for us to make sure the education level is the same, so we can share the same knowledge.
Yeah. That's maybe the picture of the at operational level, Prof. Jens. Back to you.
Pak Yusran, I think the challenges which you described are not specific to Indonesia, and they're not specific to the size of the country, and they're not specific to the size of the education level of the staff. And I'm being very direct in that, because these arguments can be used in saying, well, we're in a very difficult situation and it's very, very challenging to do something against this. These challenges, I have seen them in health insurances with maybe 100 people working in one German province. I have the same discussions. And so I think it is very important to start with the shall we call it working assumption that these challenges are normal, and that it is a normal management activity to do something about it. And now we come to the example. Maybe Dia, you go to the next page. Now we talked, Pak Yusran already talked about claims, and this is one example. So I took one claim, which is actually, I think I got it from the internet, but this is what a German claim could look like. And I wrote down on this paper, on this side, all the things which need to be checked. So on the top, you have the healthcare provider. Is this healthcare provider part of, is he correct? Is he registered with us in the health insurance? Then we have on the left side top, the name of the patient. Is this patient a patient of our health insurance? Then we have formal criteria. Invoices always are formal documents. So for example, in German, if you don't have an invoice number, it's wrong. You will not get money. So formal criteria fulfilled, yes or no. And then maybe go down a little bit. Yes, a little bit more, because then you have a list of procedures. Well, could be outpatient care, it could be inpatient care, it could be anything. And then you see, of course, you have to check this against the benefit package. But you also have to see, not only is this part of our benefit package, but does it make sense with the diagnosis? So even if it is in the benefit package, like the classic example, you don't want to pay a delivery for a man probably. So even if he is insured, deliveries are part of the benefit package. But if it's Ibu Yusran, Pak Yusran, he would still not get the delivery paid. Huh? So that must be a mistake in the claim. Do the procedures fit together? Like you have you have maybe something about a cold medicine, and then you have a bandage for a knee. Doesn't really fit together. So either they are due to diagnosis or there is a mistake. So it has to fit together. And then on the right side, you have figures. So is the calculation correct, or is there a calculation mistake? And finally, there may be special payment conditions. Maybe there is some reason why there's a rebate, you get something cheaper or something, as a package or whatever. So it depends on the specific payment criteria, reimbursement mechanism. So you see, checking. Pak Yusran said, "Yeah, we need to check claims." This is what checking a claim means. So this is a very complicated task consisting of different types of content. And now we come to the next slide, where I took the same activity and wrote it down as a business process. Go down a little bit more. Yes, wonderful. And I wrote in the heading that this is simplified. And I will tell you why. There's one major simplification is that you see that in basically every single of these squares, it says check. Now, checking, of course, means can be right or can be wrong. And here in this very, very simple process description, I always assumed it was right. Huh? And then the process goes on. But take the very first square. New claims comes in. That is the initial point. Either it depends on your system, either the insuree or the provider, could be both, sends the claim. And the first thing you do is, or could be, check if the person, which is the patient, is insured with you. Is he insured, and has he or she paid their premiums? If not, the process ends. Like, you don't have to check if the procedures are correct if the person is not insured with you. So if you basically, after every one of these squares, imagine, again, simplification, you have to imagine like a branch, yes and no. If check in insurance status, yes, is correct, then the process goes on. If insurance status, no, either it just stops or it goes back in some other activity, ask for more information, send it back. Huh? It does not necessarily have to be, it's like a full stop. It can be, but there can be a correction activity depending on the specific case. Now, so, and the sequence of activities, which is roughly logic. So it starts with the formal things, insurance status, status for specific procedures. So the person might be insured with you, but not for these procedures. Like in some insurances, you have maybe inpatient and outpatient packages where not everything is covered. Check if claim contains all necessary information. That would be the formal check. Is everything there? Then in the second column, check eligibility of healthcare providers. So you have to get into your registry of healthcare providers. Then check procedures fit the diagnosis. We have that. Check if different procedures fit together. So you actually need medical knowledge for this. You need people who are medically trained to do this. And then the third column, check if amounts claimed for each procedure are correct. That's the financial part. Check calculation mistakes and payment conditions. So this third column is more the financial perspective. And the last one, initiate the payment. And then this business process would be finished. Now, I have actually done analyses of these projects in German health insurances. And what we have in our German regulations for the claims management, we call it the 4I principle, which means for checking of a claim, you need at least 2 people, which makes perfect sense because you don't want to have one person checking the content and sending the money, because then they could just check the content and send the money to themselves. So for fraud prevention, you want to have 2 people checking one claim. And then I said, okay, now let's see how many people do we actually have checking your claims. And it was sometimes not 4 eyes, it was something like 16 eyes. It was like 8 people looking at one claim. Now, if you break this down, the first column, formal check. Insurance status, like the people who know you had the registry of insurees. The second column, you need a medical person, somebody with medical knowledge. That's a different skill. The third can be done by somebody checking the financials. And the fourth is the financial department. That is probably even a totally different division of your company, which then sends this to the bank. And it is quite common that these activities, or that's what I would be trying to find out. This is sort of the generic version. What does this process look like in real life? Like follow the paper. No? It's either digital or the paper, and you basically see, so how does this get in the claim? Who gets it first? What do they do? What do they check? How do they give it to the next person? What does the next person do? And for example, I had one case where it was 3 or 4 different divisions working on one claim, and they had never spoken to each other. And then there was this 4I principle, meaning somebody has to check what the other one had done before, but there was no clear idea. Basically, they did exactly the same work again. So there was huge duplication, and they all really didn't know. And so the only way to find out was to bring them together to one table and discuss how do you actually do it. And then you write it down much more specifically than I did here. And what I also did not do in this simplification is write down the roles. So for each of these activities, I would write down specifically who does it. Is it the claims operator? Is it the assistant of the financial department? Is it maybe a department head or whoever it might be? So be very, very specific in writing down who does what. And the description is correct at the point where the people who sit there and help you write it down say, yes, this is it. I follow this and I recognize myself in these activities. Maybe Dia, go to the next slide. Questions to ask when analyzing such a business process. And the picture is actually a workshop we did in Pakistan. A little bit different task, but it was a health financing institution. There, the workshop was a little bit more strategic, but this is exactly the setting in which I would do the analysis of such a business process. So how does the process start? Where does the claim come in? Digitally or in paper? In different forms, only one? Maybe there are different ways for the claim to come in. Which activities are carried out manually, which by IT systems? So if we talk about digitalization, normally the top management always says, yes, we're digital. Well, that's correct. And shall we say, incorrect, because, well, let me put this as a question. If you keep in mind the process which I just showed you, is the process digital if one activity is digital? What do you actually mean by digital? Digital can mean the claim comes in digital form, but Pak Yusran already mentioned the problem that you need an audit trail in Indonesia. So you need signatures. So maybe it comes in digital form, but then is printed out in paper, and then you work on it in paper form. That's basically the worst thing you can do. Or maybe you have some activities which are supported by an IT system, but some activities not. So to answer this question, how digital is this process? You have to go down to the level of specific activities. Are any necessary activities missing? Maybe somebody thinks, that's what the colleagues are doing, but nobody actually does it. Same activities carry out by more than one person. That's a waste of resources, unless there's a very, very good reason for it. Could be, but in most cases, that would be more like a misunderstanding. How many people are in total involved in the process? And do you need all of these people? Keep in mind, universal health coverage, you certainly have enough to do. So you cannot waste your precious resources by having more people than necessary actually work on this process. Is the division of tasks clear? So you have more than one person doing this process. I would assume in a normal claims process, very often 3 people, 3 different divisions actually. So do they always know what the others are doing? You can only be efficient if you know what the people before and afterwards are doing. How long does it take? Well, we're talking about business process controlling. What are reasons for the process to take much longer than that? The term would be outliers. Like if you say normally the processing of a claim takes 5 days. From claim comes in to payment is made, we manage in 5 days. But maybe 5% or 10% of your claims take 20 days. So you ask, well, why do these claims take 20 days? Where does it go wrong? What is the open question? Is it okay? Sometimes there is a very good reason. And then you say, okay, this is just life. But sometimes that helps you to understand where the process is inefficient. And how many times is it done?
Excuse me?
Yes, please.
Jens, we still have around 10 minutes.
Yes, I'm getting close to finishing.
Okay.
So knowing the volume of your process. Next slide, please. So then you write it down. This is what on the right side, a more detailed description. So what I wrote down on my slide is generic. You need to be, as I said, very, very specific. And then you start on standardization. So if different branch offices are working differently, you think, which way is the right one? You try to make it faster by reducing redundancies, and then comes the digital part, digitalization, automation. Now, I will not go into that because we're still discussing. There might be a separate lecture on IT in health insurance. But at this point, only one thing. If your business process is unclear, so if you have not done the business process management, you will not solve your problems with IT. IT has never been a solution to a management problem, but you have to know your business process. You have to streamline, you have to have an efficient business process, and then comes the digitalization. Ownership of processes. So for example, for this business process, claims management, who is responsible at BPJS management level? Who says, it's my job to make sure that every one of the 128 branch offices does it the same way? That's what we mean by business process ownership. Next slide. Now comes the project. Because by what I described, you say, okay, this is what we want to do about the project, about the process. And now you have to do that. You have to implement these changes. And the way to do that is a project, meaning you carry out these activities in a planned and structured way, which means you need to have a very, very clear terms of reference for a project, which need to be written down. It's like the contract for the team leader of the project. And sometimes you say, oh, this is only internal, and we have a very highly qualified team leader. He will know what to do. No, he will not know. Top management has to say, this is your task. This is what we want you to deliver. And these are your resources. These are the staff members which you get. You need a team. Maybe you need external support. That's something which somebody like me is doing, coming into a health insurance. And maybe my job often was to support the internal team leader, the person inside who knows the organization very well and who knows the business processes, but who is not so strong in the parts in business process management, project management, like the methodologies. You need a project office, you need a team, you need planning, risk analysis, things can go wrong. So you need to be aware of that. And you need a communication strategy, because this will be a change process, not only in a technical sense, but also in a communication sense. So you need to tell your people in the organization, 7,000 people, what will change for them. At the bottom, I wrote a very, very simple sequence of activities, not much different. But the most crucial parts are actually in the beginning, project initiation and the analysis. So you know what you're actually planning to do. Maybe the next slide. Now, these are two suggestions for further resources. Ibu Dia, I believe you will share the presentation.
Yes.
Okay, because there are many resources, and as I said, there is these are generic methodologies. So these are just things I picked out with a quick search on the internet, so you can find more. And these are both like 30 minutes, so they're a little bit more in depth. If you want to have a very brief introduction for all those subtopics, you will also find 2-minute videos. And the keywords here would be BPMN, which is business process modeling, business process management. So how do you actually do this writing down? And in a large organization, you would do this using an IT system. So you would have a software in which you document the business process, especially very complex ones. And then there's project management, different ways of doing that. As I said, Prince2 is one which I personally think is very, very helpful. But certainly not the only one. And I think that brings us to the last slide, just with a couple of conclusions. Health insurances, you have very large volumes of activities, millions of payments. And that is why business process management is indispensable. There's simply no way of doing that. And that even in our, shall we say, relatively small German health insurances, we're talking about tens of thousands then of claims. Pak Yusran could probably tell us the volume of claims in Indonesia. And the question is it only hundreds of thousands or is it millions? So just think of very, very large activities. Business process management is a continuous task of a health insurance. It's not a one-time thing. It's not streamlining your processes and everything is fine. You have to do this all the time, either because you detect something is not good in your process, or you have changes from the outside. Pak Yusra mentioned presidential decrees. And you knew a presidential decree probably means you have to change your business process, or you have new IT systems. And if you change your business processes, you will need project management to implement that. because it will change the whole organization. So that is what I wanted to share with you, why I very strongly believe that business process management and project management are really indispensable for health insurance management. You cannot manage a health insurance, any health insurance, let alone one for, as Pak Yusran said, the 4th largest country in the world, without very, very strong skills in these areas. And you basically need teams to do that. So you need a central level team for business process management and project management. It's actually 2 teams. And at the end of the day, you need people who know about business process management. It has to be a standard task of every management position in the organization, especially including the branch offices. Okay, that's it. Last slide, only contact details. So if you want to get in touch, have some ideas, I'm always very, very interested in learning more and exchanging ideas. Ibu Dia.
Okay, thank you so much, Prof. Jens, for all the interesting information. I think we are all amazed with the information you gave just now, that we have 2 terms. The first one is business process management, and we already knew what the difference between business process and project management. And these 2, I think they are families, because they have to work together between these 2 terms. So I would like to give the time for the audience. Silahkan teman-teman, Bapak Ibu, jika ada yang ingin diklarifikasi atau sharing juga pengalamannya dalam melakukan tugasnya sehari-hari. Karena tadi kita lihat bahwa banyak hal yang sudah dilakukan sehari-hari, tetapi banyak juga hal-hal yang perlu diperbaiki. Artinya bahwa bisnis proses itu kelihatannya sudah rutin dilakukan dan berulang-ulang. Tentu kadang kita juga tidak lagi bisa merasakan ini kendala apa tidak ya, begitu, karena rutinnya tadi ya. Mungkin ini yang nanti menjadi PR kita bersama juga, bagaimana memadukan bisnis proses sehingga kita tahu di titik mana improvement itu bisa dilakukan. Karena sekali lagi menggunakan resources dengan smart, karena kita juga punya resources yang sangat terbatas. Saya rasa ini juga satu strategi ya, Pak Yusran. So, Prof. Jens Geisler, I would like to invite all the audience if there are any clarifications or maybe sharing their own experience in their daily operations or daily activity. Silahkan bahasa Indonesia juga boleh. Mudah-mudahan saya bisa membantu. Silahkan kalau ada yang ingin klarifikasi. Atau tadi menarik juga ya, so Prof. Jens Geisler mentioned about 4 eyes. 4 eyes means that not only one person to check. So this could, I think this could be an issue, that how to avoid fraud before it happens, and also to minimize also dispute or other problems, especially connected with claim issues.
Yes, but what I see more often is that this is overdone. Yes, you need having 2 people is correct, but the problem which I saw in the German insurances was that it was not 2 people but 6 people, and that is too much. And there is no way to get an efficient process if you need 6 people to check a claim. You can't do it. And the other point is that leads a little bit more to digitalization, but it has to do a lot with business processes and putting them in a digital way. The worst you can do is have a paper-based process and a digital process new, but then you don't change your paper process. So sometimes you have the situation that through digitalization, you actually have more work than before. And that is something which you have to be very, very careful about, and which you will recognize when you do this kind of analysis. When you ask the people, has the digitalization helped you, or are you actually more busy than before? That's where the project or then change management and project management comes in, that you actually have to say, okay, it's not only a new digital process, but the old process has to either disappear or be changed, adjusted drastically, so that you actually make it more efficient. So that was actually one situation which I came into, one health insurance, which had started digital processes, but said, well, surprise, we're not more efficient. Pak Jens, what can we do? And then you start analysis. And maybe final point on this, what Pak Yusran said, signatures is actually a major problem. So if you do digital processes, you need digital signatures. There is no way, because if you don't have digital signatures, that means that in the end, you will never get rid of your paper. And I had hours and hours of discussions in German health insurances about digital signatures. Now, they're very complex systems, and staff members were very frightened of them because they did not really understand. So I talked about communication, introducing digital signatures, which in some German health insurances, I know somewhere that happened maybe 3-4 years ago, not long ago. You need to give a lot of information to the people, tell them what significance this has if you don't write your name on a piece of paper anymore, but you write it suddenly, you punch in your number in the computer, and how does this work? What happens with that? But it is, you have, from a business process perspective, it is absolutely essential. Dia?
Yeah, Pak Yusran, any information you want to clarify or you want to add more? Pak Yusran?
Yes, Budia. Thanks, Jens. That's correct about the digital signature. It's a really complex system. We have to talk each other, and some people keep asking about, should this one exchange the manually hard copy or something like that. But I think if we jump to the digital signature, I think it's the very next jump. At first, maybe we start with the digitalization. At first, something like computerization, something like more manual tasks into the computer. Maybe it's the first step that we have to try to identify, in my opinion. What do you think about that, Jens?
That is certainly correct. And as I said, you first have to have a good grip on your business processes. So I think the business process management comes first. Then comes the digitalization. And as you said, what you would always do is start with the easy parts. So start with the parts which do not require a digital signature. And that is certainly possible. For example, you could call that decision support systems, like which help in the process which I showed, for the easier parts, which show you, oh, the calculation is wrong. So that could be a decision support system, where at the end then the staff member still writes down the signature and says, okay, the claim is correct. Another way, maybe, sometimes you can sort of jump technology steps. A different topic, which maybe we will do in a separate lecture, would be automation of business processes. And if you actually don't have a staff member involved, you don't need a digital signature. So maybe if you do some claims, some checks, like for example, insurance status, if you do that automatically, maybe you can actually do that without a signature. So that could actually be one thing to think about, which are steps which at the moment, which are somehow done or maybe not done enough, but which should be done, and which do not legally require a separate signature. Or maybe you can say you have a signature if the claim is not correct. If you subtract the payment or if you withhold the payment, but maybe you do not need a signature if the claim is correct. So thinking about that, do we need signatures, legally speaking, in all places where they are taking place now, could also be one step.
Yeah, Prof. Jens, there are many questions that posed to you, but because we only have limited time, so I will send it to you by email, and then I will forward this your response to the student.
Mm-hmm.
Yeah,
yes.
So I would like to thank to all of you, both Prof. Jens Geisler dan Pak Yusran. Thank you very much for your time, and also to all kepada Bapak Ibu sekalian yang sudah hadir juga dalam forum ini, juga untuk Bapak Ibu yang hadir melalui media virtual lainnya, kami ucapkan terima kasih banyak. Mudah-mudahan serial ini akan bisa kita lanjutkan. So we would like also to invite Prof. Jens Geisler and also from BPJS to share their thought also in our second serial, more on deeply or more detailed to the digitalizations. Thank you very much for all, dan terima kasih banyak semua yang sudah turut serta, dan terima kasih juga untuk Mbak Gitka. Saya kembalikan kepada Mbak Gitka.
Terima kasih kepada Ibu Dr. Dia Ayu Puspandari MKes MBA APT yang telah membimbing acara pada hari ini, dan juga terima kasih kami ucapkan untuk narasumber yang telah memberikan ilmu dan bersedia berdiskusi bersama kami pada hari ini. Baik, Bapak Ibu, kami segenap panitia mengucapkan terima kasih banyak kepada Bapak Ibu yang telah hadir pada acara hari ini. Semoga kita semua mendapatkan manfaat dan dapat diterapkan kepada instansi dan negara Indonesia kita yang tercinta. Dan kami mohon maaf apabila ada kekurangan. Kami telah memaksimalkan yang terbaik untuk Anda. Sampai jumpa di acara guest lecture selanjutnya. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. So see you in next session, Prof. Jens.
Thank you, Prof. Jens. Terima kasih Pak Yusran. Terima kasih Bu Dia.
Yeah.